Welcome to our program on Kardec Radio.
Hello, everyone. Good to have you all here with us today. And today is a special day because we will have our friend, Dr. Sergio Thiesen, with us again. And it's a pleasure to have you here with us, Dr. Sergio. And Dr. Sergio is almost a member of the Spiritism Society of Ireland. I think we just missed 1 or 2 years. The other years since I'm here, he's coming to Ireland and always give us his wonderful speeches. So, good night, my friend. Good afternoon for you. Good night for us here. Huh?
Yeah. Thank you, Stephen. I am in Rio de Janeiro, and I am very glad to stay with you and your friends this time. Thank you so much.
Thank you, our friends. Now we have Leah from Sweden. We have friends from Ireland. Let me see here. Portugal, Brazil, and America. Good to have you all here with us today. And I know more people will join us. Linda from Texas. Good to have you, Linda, my dear. So it's good to know we have your support. And as everybody knows, and since we are streaming that September is considered Yellow September. It's a kind of worldwide suicidal prevention. And I don't know any better person to talk about it who knows the cases deeply and could give us better understanding of this bad scenario, I would say. Today's topic is spiritual aspect of suicide. And Dr. Sergio will talk about 45 minutes, 50 minutes, more or less. And then we will open to questions and answers. If we finish our time, I will send your question to Dr. Sergio, and we will post the answer later on here on the comments. It's okay, my friend?
Yeah.
Okay.
Thank you.
Okay, so let's start with our initial prayer. And I would like to invite everyone to have a deep breath. If you can, if you want, close your eyes. Open up your mind. Lift up your heart towards Jesus, towards our Master, who is watching us now. Please clean us up from any bad feelings, any disease, taking away all these bad feelings, restoring our energy with His love, His mercy, looking after all brothers and sisters who are in the hospitals, alone on the streets, who are suffering from anxiety, who are with depression, thinking about suicide. May this prayer reach their hearts and light their hearts. So be it. Amen. Okie doke. Dr. Sergio. Well, just a small CV from Dr. Sergio. I forgot to ask him, but I know by heart some parts. Dr. Sergio, he's cardiologist, and he's gave a speech in United Nations. He's part of the well, I don't remember the name of the group you are in Rio de Janeiro,
Reencounter Spirit Society.
the Culture Spirit Society, and he's a wonderful friend and look after everyone who seeks any help, seeks any advice, and it's wonderful to have you here, my friend. Thank you very much.
Thank you, Stephen. Well, my dear friends and colleagues, I would like to talk to you about this issue, suicide prevention. You know the bad situation in this humanity in those days. I would like to talk to you that I am a physician during the last 40 years, and I live in Brazil during this time. I am spiritist during all my life because my parents they were spiritists too, and I am studying and working with mediumship during all this time. So I learned as a spiritist that on earth we live in two different situations, or we are reincarnated as we are now, or we are in the spiritual realm when we are between two different reincarnation. And we know that the earth, it's not a common world. It's not a regular humanity. This is a very sick people that we are living here as spirits, sons and daughters of God during many and many millenniums, trying to recover in terms of moral and different aspects. So, a word as here as a word of tests and atonements. This is a very primitive word. And you know, for example, the extensive problem during all the history of humanity in terms of wars, in terms of bloody revolutions, in terms of violence in many ways, spread in all the different scenarios in different continents and countries around the world. And one very important aspect is the idea that we don't know in terms of the global life what we are doing here. What is the main objective of our lives? From where we come? What is our destination? So the people, in general terms, we have here billions and billions of human people, incarnated and reincarnated. We have more or less 20 billions of people. And in the majority of cases, the people don't know about themselves in terms of what is the importance of life, and we don't know nothing in general aspects about spirituality, about the true intention or reason of our eternal lives. We are eternal. Our body, we live during some decades. But here, it's not a common word. As a medical doctor, I can see thousands and thousands of different illnesses in my activity as a doctor. We have problems in the cardiovascular system, problems in the infections, infective diseases by virus, bacteria, fungus, and many things. We have endemic diseases, pandemic. We have a very intensive scenario of suffering during our old history till now. So I would like to tell to you about that. When we have a better idea of who we are and what we are doing here, we can have some kind of enlightenment about ourselves. And so we can react in a better fashion in terms of the day by day, decade by decade of each one in this world. I would like to tell to you too that we have a big problem. For example, in each 40 seconds, we have a complete suicide. So we have a very special drama in this humanity. And now, because of the mental diseases, we have a big number of cases of depressive people, people in an epidemic character with anxiety, schizophrenia, chemical difficulties with alcohol, cocaine, and many different chemical substances, addiction. In all of this world, each country, each region. And I have autism in our children and youth people. We have a very severe condition of mental diseases in the humanity, especially after the pandemic of the coronavirus. So the number of cases of mental problems, mental disabilities occurring all of the days, this is the strong relationship between suicide. So, for example, if we want to prevent suicide, we need, as common people, as health professionals, as doctors, pediatricians, general clinical practitioner, as obviously psychiatrists, we need to recognize mental disturbances. And in all of the diagnoses in medicine, we have different levels of severity. And frequently, all of that psychiatric diseases, they stay without the proper diagnosis. And when we have this scenario, the risk of suicide in society is very great, is very high. So, first of all, we need to know about ourselves, about this kind of humanity, of tests and expiations, including many different aspects of suffering. And because of the difficulties of the people to understand the life, to understand themselves, the suicide ideas, the suicide attempts, and suicide conclusion. This is very common, and this is a big problem around the world. And as a doctor and as a spiritist, we are receiving many and many different asks for helping people, with people with suicide ideas, or after 1, 2, or more suicide attempts. So the group of the people reincarnated, but unfortunately, we receive all days because the people knows about our group of work, trying to help the discarnated one with living in the spiritual reality after the suicide. We are doing in this September, especially, one program, one project to talk about suicide to all of the people in different languages. And we are receiving, because we are inviting people to refer to me, all the family, people, colleagues in work, neighbors that commit suicide during the last 50 years. So only the people around me in another day, we care with a mediumistic group, near 400 names, 400 people, men and women, including youth people and children, in different countries of this world, to rescue from the bad spiritual spheres of life, because when the people commit suicide, in the majority of cases, they will stay in the condition of suffering, including, obviously, the previous suffering during their lives, but now a new suffering in the spirituality, because they go to a very dark condition in the spiritual reality. And this is the continuation of suffering. So we need to talk about suicide, because I live, and you too, in one time that the people don't talk about this, because they have the idea that once more we talk about suicide, one idea that we are provoking this idea to the community, to the people, and then this can facilitate the arousing of suicide ideas, and from suicide ideas, attempts and completing the death by suicide. But because of very important studies in psychiatry, we learn, we understand now this is the opposite aspect we need to talk about. We need to open our life, heart, soul, institution, community, to hear the people that would like to talk with us, common people too, about their problems. Because the people have mental problems. The people have difficulties during their lives, at home, at office, and in many different situations of their lives. So, for example, the World Organization, there is the idea, let's talk. We need to sit with the people, to hear them. Let's talk about your problems. What is occurring? What is why you are so sad? I can see your suffering in your eyes. Please tell to me. So all of the people around the world one time once informed about this big problem in this humanity. All of the people can help hearing our brothers and sisters, independently of the linkage of different aspects with us. But in terms of medicine, depression, anxiety, social isolation, for example, in the United Kingdom, during the last year, when we are in the pandemic, we have not only in the United Kingdom, in Brazil, in Mexico, for example, and some states in the United States of America, from good works in the medical literature, with fine methodology in terms of research in this area, we have something like the double of the number of cases of depression, anxiety, and suicide attempt and conclusion. So we are dealing with a big challenge, unfortunately, in this world, on earth, when or where all of us we are living now. So we need to have schedules to deal with this problem. And it's very clear that we need to talk about this. When we use medicine to give to our patients with depressive disease, depression, independently of suicide ideas, depression, we need to use medication, antidepressive drugs to help all of these people. But to use the medicines, we need first to recognize the risk, to recognize the signs and symptoms of depression, to use the drugs to benefit the patients. And when we recognize and prescribe the drugs, the people begins to feel better. And this is important in a medical point of view, because we are spiritists and we know something very clear about the spiritual context of each one in this world, especially each one with suicide ideas. And we have some tools to use to help those people with those kind of problems. Here around me, for example, in Rio de Janeiro, in Brazil, or maybe in a different state or province in Brazil, but we are trying to help people with this problem in different countries and cities around the world, because we have the facilities of WhatsApp, of Messenger, emails and cell phones to stay together and opening cases of suicide risk. And always when we utilize the mediumship group of our institution and the institution linked to us by lives, by StreamYard, by Zoom and different platforms to stay together, we are trying to go inside the spiritual problems, independently of medical conversation or establishing a good physician-patient relationship. Because always we have in all the patients with mental diseases, independently of them related or not with suicide ideas, we need to open our spiritist meetings to help the people with important risk. So we need to listen, we need to hear, we need to stay together. I would like to tell you too, in this way, that we are changing our medicine. We have more or less 5,000 years in the history written of humanity and medicine. But we did not have one time like this in terms of mental illnesses, suffering in terms of mental problems and diseases. So we needed to study in a different paradigm how to change those things. We are coming from a very old and during many times when the materialistic way of life, a materialistic medicine, because the people only understand anatomy, physiology, pharmacology, and clinic and clinical approach to the patients, only dealing with physical body. But now, as spiritualists and spiritists specifically, we can understand the reality in a different way. So, for example, in medicine today, we use the prayer, the compassion, empathy, solidarity. We are dealing with some kind of spiritualization of medicine because of Allan Kardec and the good spirits around him. Now we have a different understanding about life. We know about spirituality. We know that we are souls or spirits. We are specifically one kind of souls and spirits with very different spiritual problems accumulated during many and many thousands years or centuries in the past. But we are here to obtain our spiritual, moral development. And we need to know how to do this. First, the idea, some kind of conscience about this. Because in general, the people are living their lives, materialistic lives, trying to obtain many different acquisitions, but only in material aspects, money, properties, titles of science, of honorific titles, frequently not including the valorization of family. In different societies around the world, we need to change. We need to know that we are eternal, and we will have all the centuries in front of us to know about reality, not only the reality of the nature on earth. We need to understand the universe, the mechanisms. We need to see ourselves including in the work of God, our Father, to help us developing ourselves to happiness. This is a transitory world of difficulties, tests, and atonements. So I would like to tell to you that we need to care in this matter, the prevention. So we need to stay together. We need to help one another. We need to have satisfaction, happiness to help the people, independently of the problem and the diagnosis. But frequently, because of different problems around the world, including wars, pandemics, including unemployment, social difficulties, in different countries, including United Kingdom, including United States of America, including Brazil, in a very big social disabilities and inequalities in the people. So we need to care. We need to care not only in the word of the incarnated people, but because we are spirits, we are changing our mind in terms to know about this word and to put in evidence all that we have to help the people with different problems, to prevent suicide. Let's talk about your problem. But we understand now in medicine that we can, in our office, in our work in hospitals, clinics, emergency departments, intensive care unit. This is where I am working as a doctor, for example, and many of our colleagues. We can now talk about spirituality. In the World Psychiatry Association, in different big congress, the best congress in psychiatry today, during the last decade, I was there talking with my colleagues. I am not a psychiatrist, but I am sharing with my colleagues in this area, in this specialty, about spirituality and mental diseases. How to care in a spiritual manner with some people with suicide ideas, with 1, 2, or more suicide attempts. Because all of these people, they have one dark spiritual environment, because old lives of them, and they did something in the past, creating problems today, brothers and sisters, in family, in work, in streets, in institutions, in wars, in revolutions, and in many spiritual problems in the past words. And then that people are around the incarnated one with suicide ideas. So when we open the case, many cases during the last decades, we always find spirits, discarnated people, and we receive them with by our mediums, psychophonic mediums, to talk with them, some kind of psychotherapy with discarnated people. Let's talk about your suffering. What you are doing now with that people that are thinking about suicide thoughts. And during some minutes, with prayer, with hands in position, trying to help with spirit magnetism, we can help those people, and we can guide them to a better sphere of life. And then very frequently too, the suffering people with suicide ideas, they recover mental health. So medicine is changing. For example, my friends, I am talking in the cardiovascular congress with my colleagues in cardiology area about spirituality and cardiovascular disease. And obviously, because the spirituality in psychiatric disease, this is very interesting, this is very clear, and we are in a debate with my colleagues in medicine, talking to them about patients before with suicide ideas, with depression, anxiety, schizophrenia, autism, and after this mediumistic approach, revealing this different medicine in a different paradigm, spiritualistic, but specifically spiritist approach. And the benefits, they are very clear. And I would like to comment with you, sharing with you about a new era that are beginning now only because we have spiritism, and we have now conditioned to understand in a different manner the reality of the world, of the people, including the influence of discarnated people in our lives in many ways. But in this issue, this is very not only interesting as a scientist, but the main objective is help the people, including, this is a different medicine, because when we receive one case to help, we open in the mediumistic meeting, we find spirits, sick people in the spiritual world. So all the good spirits around us in the meeting, all the mediums, incarnated people, as I am, we put all the good things to help and to do some kind of medicine to the discarnated people too. And we have now a very nice possibility to do things to change the other reality too. Do you understand? So in the other side, we have hospitals, we have clinics, we have nucleus of groups of good spirits, independently of hospitals and clinics, trying to receive the people in one intermediary situation between material world and the spiritual world. And we are outside the body with our groups, carrying those people. And I would like to tell to you, I visit many countries during the last decades, and not only to do some conferences or studies in groups, in spirit societies in different cities around the world, but frequently because of this experience in mediumship, I stay with the mediumship groups of different countries, and we open the cases independently of the diseases and disturbances, and frequently suicide attempts, to help the people of that countries. And I understand, because of the opening space in the best congress in cardiovascular disease and psychiatry, that the scientific committee, they opened the congress to me to talk about spirituality, mediumship, Allan Kardec, spiritual world, discarnated people, mediumship, and many things. But the most interesting and enthusiastically that we can talk with them, the idea of the benefit before and after this approach. So we need to valorize spirituality in terms of spirituality, religiosity, and suicide prevention. We need to talk about reincarnation, about the afterlife, about that the life of everyone, it is eternal. We only change our word, but our problems we will have after the suicide. We are the same in the other side of life. So, Stephen, remember that I was invited to talk about depression and suicide in New York, in the World National Organization, because we have some kind of seed. This is a seed, a spiritual seed to put in evidence the importance of the spiritual reality of our true condition as sons and daughters of God, not only our physical body, but we are eternal, and we need to talk about those things. In medicine, if I enter just now in the PubMed, the site of looking for abstracts of research in medicine in all over the world, from NIH, National Institute of Health in the United States, New York, if I put religiosity, spirituality in a site only of medicine research, I have thousands of papers to study with my colleagues in all of the countries. We are changing, but we are much more in the world of materialism, that we need to talk about this to spiritualization of life. We are not bodies having some kind of spiritual experiences in different days, eventually. It's different. We are spirits, and we are during some years in this world to obtain the moral, spiritual development, but we have one God invitation to the great future, to be happy, all of us. So we need one day to talk about the wars, the induced abortions, pandemics, violence, because including suicide, obviously, because all of this are interlinked. When we have one common approach, one common side idea about, we cannot see the linkage between them. But if I use the past lives, the immortality, the history of this mankind in a word, some kind of primitive word, or the word of tests atonements, we will have the idea of action and reaction, cause and effect law of personal responsibility. And then I will use my time. I will spend my time to dedicate the better that we have in ideas, in actions, trying to invite people to think about the word and the life, enlightening this scenario of our humanity. We have a big future. We need to work to all the people could understand this approach, this idea of reality, because we need to change. We need to do, in terms of work, family life, common life of everyone in different ways. So prayer, meditation, compassion, solidarity, work to the people that need meals, food, peace, understanding in a different way about their lives. We can save lives if we talk about those things. Well, this is a very interesting issue. I would like to have more time to do some kind of seminar about with a different way. But I think, Stephen, this is some reflections that we could do in this afternoon, in this night.
This was wonderful, my friend, to give a notion of what's going on behind the scenes, because for some people this is new. For some people, this is a kind of forbidden thing to talk about. And now we are trying to make this more aware, kind of awareness campaign. Based on that, we do have here two questions for you. And put it here. My best friend in the States wished for many years to die, over grief of losing her sister to AIDS. Juju got on pain management program. She used her husband's urine to pass the drug testing. She was prescribed fentanyl patches that she chewed. A few months she succeeded. September the 30th will be the 7 years. I talk to her all the time. I miss her so much. Question: is there any way I can help her spirit not to have to wait so long in line with others who have also suicided. I wish I could have given her 3 points here. So basically the question here is if she can support her friend to go through these difficult moments in which her friend has AIDS, there's no cure, and she may die anytime or not. Like we are advanced a lot, but she always wake up with the doubt in her mind.
Well, unfortunately, we are doing some medicine in those days with the tools that we have in United Kingdom, in Ireland, in many countries. But we have some different approaches, but we have very difficult histories with the people around us, in family, in society, in the work environment. This is the common situations. But I would like to have the possibility to talk to you as soon as possible to do something to try to prevent, because frequently the people with depression progress in time with more severe depression. So we have one time to work to benefit the people. So I understand that if your friend, she did not commit suicide yet, I can help her opening in a spiritual point of view with my group in Brazil, try to help her before she commit suicide. And Stephen have my cell phone, my WhatsApp, and I can share with you about this issue if you want. And I can share with your friend trying to help her. But as I spoke first to the people that committed suicide, we only have a good job to help, but obviously that people in the spiritual reality. But we need to do it because the people can stay many years in suffering in the other side of life. So spiritualism, religiosity, spirituality, and many ways related to this, we can offer to the people and to the family and to the friends and to the doctors. For example, as I comment first, trying to put those spiritual things in evidence. Thank you.
Another comment from Leah. By the way, Leah, send me a message on Messenger, and I will share Dr. Sergio Thiesen contact number. Okay?
Yeah.
I myself are on doctor's care for anxiety, social phobia, suicidal ideations. Losing my father, I was only witness to his murder by my mother. I have spoke to him as a child, but no longer as often. I carry his photo everywhere. Just hurts. I need a better therapist who is a spiritist. I have my spots picked out. ways to make it no messy for someone to have to clean or see me. Now I am on Lamotrigine, Anafranil, Xanax when needed. Finding Stephen, Allan Kardec, reading, I am not as obsessed as I was.
Leah, I think that the Stephen group of the Spirit Society, he can help you. But as we are talking about from the beginning of this short lecture, uh, here in Brazil, I have one spiritist group, and I am dealing with this with different patients, people around the world, trying to help them. The people with depressive disease, with suicide ideas and ideation. And if you want, you can take with Stephen, and I can try to help you independently, Leah, of the medical approach that you have now from your doctors. But I understand that we need to look for the past lives and the spiritists around you, linked to you, including helping your father that was dead, because this is very important. Feeling, he is our brother, and I don't know about his situation in the spiritual world. And frequently, this is important to the people in this world, the material world, because we have linking, a spiritual, different linkings from this reincarnation of both, but frequently from the past too. And in medicine, we need to individualize the approach. Each one is different from the other. So we need to specify I need your name, your address, and I can verify what is happening in your spiritual context. And everything that our mediums can detect, we will care, we will rescue, we will guide to a better and happy sphere of life. So I have patients from other doctors near me that have patients with different kinds of diagnosis in psychiatry during or from many years. But when we look for one spiritual help in this fashion, it's very clear before and after. And as your friend or your brother, I can try to help you too.
Great, my friend. We are already past our time here. I have comments like I would also like more time on this very important issue for our world.
Sure.
Yeah, we will.
Sure.
We will have more time for sure. So, once again, my dear friend, thank you very much for your wise, enlightened words. I'm pretty sure your words it's helping someone who are listening us or we will listen this live in the future. And I just wish you to keep going in your hard work, and we always have our open doors here with us.
Thank you, my friend. Thank you.
Okay, so would you mind to do a final prayer for us?
Yeah.
Yeah, good.
Well, I would like to stay with all of you in this moment, remembering that we are sons and daughters of God. We are remember Jesus Christ and all of the so fine, so beautiful in a spiritual way of spirits that are together with all of us just now. They come from different countries because this matter is important to everyone. And because they are from the superior world, they stay with all humanity in this hard moment of ourselves, giving us hope, moral dedication with all of they have from the heaven, the stars, the love to all of the people on earth. We are so much as brothers and sisters linked together, receiving the good fluids, the magnetism from the heaven to the people in Ireland, in Brazil, but in Afghanistan, in Haiti, in India, Australia, United States of America, and all of the world. They invite us to pray all days to the dramatic situation of different people around the world, because when we pray, they talk to us, they help the people I love as just now. Thank you for all of you from both sides of life, friends of mine, including the good spirits that are together now with the people during this life, and with the blessings of Jesus, we can now finish this study. Thank you so much to everyone, and we would like to ask to God to permit that we can share again in the next weeks or months different thematics in spirituality, religiosity, and so on. Thank you. Thank you so much.
Thank you. Thank you so much, Dr. Sergio Thiesen. Just remind Dr. Sergio Thiesen, he holds every day a prayer for the humanity. It's 5 o'clock Brazilian time.
Yeah.
Yeah, it's 5 o'clock Brazilian time. And I will put it here in the comments how you can reach the group, and you can join him in these efforts to pray not just to ourselves, but our brothers and sisters around the world.
Thank you, Stephen.
Okay?
Okay.
Thank you very much. Amazing talk. Compliments here from our friends. See, a lot of people here. Thank you. Thank you very much. I'll see you on Thursday with our study of the Spiritism book. Thank you. Have a good night. Bye-bye.
Bye. Thank you.